Hello, happy Monday again. Welcome to our Learn with Lo session. I'm excited to come to you guys after hopefully a restful weekend and really start to dive into a topic that I know is of pertinent interest to a lot of different individuals based off of the people that I get to see in my clinic every day and some of the different health journeys that they've been on before they even come and sit in front of me. And that topic is supplements. I feel like we've been giving a lot of attention the last couple weeks to this world of like the wearables and the health technology between tracking things like HRV, which we talked about that with being a marker of our stress response, or things like monitoring our blood sugar with things like continuous glucose monitors. And last week we really talked about how that all tied into this term that is going to, in my opinion, be a very up and coming term that we start to learn a little bit more about in the world of health, wellness, and hormones, and that is that term of metabolic flexibility, right? So with all of these conversations, I obviously talk a lot about the impacts of things like stress, internal stress, external stress, perceived and not perceived stressors, blood sugar imbalances, like I said, dietary changes, lifestyle interventions, all of those types of things, circadian rhythm, and you would be surprised, maybe not surprised at how often then I get the question that individuals then look at me after we have these conversations around their labs and all this stuff. They're like, what supplement should I take for that? Big old face palm on my part, right? It's like, this is not a supplement journey, right? Your health is not one medication, one pill for every ill that fixes everything. And I think that we've become so in tuned with that in more of the traditional medicine route. And a lot of people are becoming a little bit, I guess, smarter to that whole vicious cycle that sometimes we can get into in more of just like a big pharma setting where we go into our doctor with XYZ symptoms and we walk out with XYZ prescriptions, right? Not really a conversation around, well, how did this come to be? What has been some changes in terms of diet, lifestyle, exercise, stress management that could maybe be potentially contributing to these types of symptoms. It's really just a, hey, give me a quick fix. I don't want to really change anything, right? And that's where we start to get into this mentality and get lulled into this mentality that that's how health works. That if we have an ailment or we have an issue, we can go to a health professional and they'll give us something to fix it and we can just go on with our life, right? And the more and more we get into that, we realize that it really doesn't fix anything, right? So look at where we've gotten to even just with traditional medicine approach with this pill for every ill. We had this huge push and awareness around things like cholesterol being this main driver of heart disease. So we come out with this miraculous drug of statins, and yet heart disease and strokes are still top 5 killers of individuals on a regular basis. So it's like, our statins are obviously not fixing a heart disease issue, right? Similar where we see this slew of individuals with blood sugar regulation issues and type 2 diabetes. So we come out with things like metformin, right? And we give people these drugs around metformin and we still have rampant type 2 diabetes. So it's not fixing the issue, right? Even in a women's health world like birth control. We have all these period symptoms. We go into our doctor and they're just like, here, just shut it off. And we pretty much then have a birth control. And then before we know it, next year we're going in and getting an anti-anxiety or an antidepressant medication because of the side effect of the birth control. It's this whole vicious cycle where we've really lulled ourselves into this false sense of understanding that managing our health and wellness is just a matter of, oh, we'll take this and the problem goes away, right? Or take this and the new problem that you developed actually doesn't have anything to do with the other problem. This is completely separate and I have a pill for that too. It's like we can't isolate the body like that. It doesn't work that way. We are one body, a series of different systems that all coincide and respond and react together. So you guys, that have been following me a while understand and probably have a little bit of like-mindedness around recognizing some of those limitations that we get when it comes to anything proactive or preventative care doesn't really fall into the traditional healthcare model. We try to make it fall into that, and then we get disappointed when we use the traditional healthcare model for things that are supposed to be like preventative and proactive, and that's just not how that system was built. That system was built for acute care. We have a life-threatening issue that needs to be dealt with right now. Absolutely, traditional medicine comes in and saves the day in that aspect. But then when we're looking for resources to really proactively help us manage our health, we've gotten a lot more attention towards maybe some alternative medicine or what we call this functional medicine approach, right? So I really love this, at least transition and I guess you could say curiosity that individuals are getting around exploring different avenues to manage their health and wellness. But I think just as much as we expose some of the limitations of the traditional healthcare model, we also have to talk about the very, very real limitations that exist in the functional medicine model too, because I see this so frequently. And it can be really, really debilitating and disheartening because individuals that get failed by the traditional medicine model, they go over to this functional medicine model really with an open set of arms and eyes, and then they get failed by that system too. And that's just because we're trying to essentially take this big pharma model and slap something else that's the same concept, but under this whole label of supplements, right? So this is where I wanted to start to dive in today. And I think the traditional medicine, like I said, we understand the limitations there, but then there's not enough attention given to some of the limitations in this functional medicine space that I think honestly need to be called out just as much as some of the limitations of traditional medicine, so that we know what do we use each of these models for and where can they kind of be a slippery slope that we as a consumer need to watch out for, so we don't get lulled into kind of a false sense of hope or a false sense of security, right? So I have some really good stories that'll go along with this as we go, and they'll really make a lot of sense. But I want you guys to start to think about, even those of you that have dabbled with or been exposed to some more of that functional medicine approach. I love the idea where we start to put the body together as a system, or we at least start to dig for the root cause of some of these symptoms, and starting to maybe even look elsewhere, think outside the box, right? But the functional medicine model is just as guilty of what I would call template medicine or some cookie cutter approaches. And you go in and they're like, oh, you have bloating, here's your XYZ supplement protocol, and here's your meal plan, and they send you on your way. And it's like, okay, so everybody that comes into your office just gets XYZ supplement protocol and a meal plan and gets sent on their way, but there's no real relationship building, there's no coaching, there's no digging, there's no understanding of like, what does my life actually look like, and can I sustainably make those types of habit changes that you're asking me to, right? So there's a lot lost there in terms of just relationship and community building, but not to mention that we're literally just treating the big pharma model the same exact way under this supplement umbrella and saying, oh, you came in with XYZ supplement or XYZ symptom, here's XYZ supplement protocol that goes along with it. And the problem is again, there's some of those things that may work for a minute, but then they don't. Or we felt relief for a minute, but then not so much. And that's because we never really addressed the root. We just put a bunch of different random supplements on top of the same symptoms without forcing the individual to truly address the habit change and the lifestyle circumstances that got them into that symptom position in the first place. And we essentially just continue to feed that idea that if we have a supplement, we don't necessarily have to make any changes. We can just, or if we have a symptom, we don't have to make any changes. We just have a supplement that I can give you and I can just make it miraculously go away and you can keep going upon your merry way, right? That's not how this works. That's not how we manage health. That's not the definition of health. And we want to make sure that we have a much different look at this supplement world, because I think that there is a right and a wrong way to use it. I am not anti-medication. I am not anti-supplement. Anybody that works with me knows that we want to, at Renew, really marry together both of these worlds of modern medicine and nutrition and lifestyle interventions and get people the best outcomes and the best success. But we understand that it's not a cookie cutter approach. Everybody should have a different path. Everybody will have a different path because you're a unique individual, not a cookie cutter approach. So I think that there is a right and a wrong way to use supplements, but it's not for Band-Aid solutions, right? So take, for example, like a blanket probiotic. How many people go out with a gut issue and they're like, oh, my friend of a friend of a friend sold me this probiotic from her MLM model and this greens powder and told me it would make all my bloating go away. And it's like, oh yeah, I felt better maybe for a day, but then not so much because we really didn't fix the underlying problem, right? Or even things like utilizing like melatonin. It's like, oh, it helps me sleep. And it's like, did we really address why we might be having sleep issues? Are there some hormonal reasons under the surface that we really aren't tapping into and we're just kind of slapping a Band-Aid on top of that situation? Or even convincing individuals that like protein powder is a sufficient like meal replacement. I'm like, that's not food, that is powder, right? We can't just think that these things kind of replace each other, or that these supplements replace the value of having to make dietary changes or having to make lifestyle changes in order to operate under a better metabolic health landscape, right? So I say this because, again, I think we get kind of lulled into this, like that this family of supplements is somehow better than a big pharma approach, when in reality, from my perspective, I'm starting to see a lot where people are getting almost the same message from both sides, just using a different vehicle, right? It's like, okay, big pharma might be under more of pharmaceutical interventions and more behind the counter type access to those types of things, or a supplement world is the same thing. I'm giving this understanding that I can just out supplement a crappy diet, or I can out supplement the fact that I don't want to learn how to manage my stress or fuel my body properly or address my sleep issues, right? So those are the biggest kind of probably issues that I tend to see. And I think that what we'll dive into now is kind of the right and the wrong way to use supplements, and how I use supplements with individuals in my practice, and how I would encourage you guys to start to view and see them as well. And I think what really spurred off this, a blatant need, as if I didn't see it already, but some typical examples of what I've been able to see in clinic recently. We got to meet a woman who came in and has been through the ringer of traditional medicine. She name dropped probably at least 3 to 5 different practitioners here in the Omaha area, all of which I recognize because we're a pretty small circle, right? So she's been to all of these different practitioners, and I'm not even kidding you. She brought in bags, plural, bags of supplement bottles. And that was our first initial consultation, and knowing that had been her understanding of nutrition. That's what had been fed to her through all these different practitioners that she had been to. She did testing at one practitioner and they handed her these supplements and sent her on her way. She didn't feel better, so she went to another practitioner. They tested her, they handed her a different set of supplements, and she went on her way. Another practitioner, more labs, more supplements. You see the repetitive pattern here, right? But nobody really helped this woman identify, what are you eating on a regular basis? When are you eating? How are you eating? How are we fueling our body? What does our sleep look like? What does our mood feel like? What does our relationship with things like caffeine and alcohol look like? What is our overall stress levels? What's your family home dynamic? How much or how little do you cook outside the home on a regular basis, right? And she just wanted so much to talk about these supplements. And she's like, well, should I be taking this one? How much of this one should I be taking? Do I have too much much of this one? Do I have some toxicities built up? And it was just so much. And you could tell she was overwhelmed and panicked by it too. And I was like, I had to stop her at one point in time and point to all of these bottles. And I was like, this is not nutrition. This is not food, right? You cannot use these as a replacement for putting in the work. The God-given food that is grown from the earth will never be bottled and capsuled. You have to start there first. That has to be 99% of what we're putting in our body on a daily basis. And the rest of this is too much. This is overwhelming. You have so many duplicates here. I don't even know what you're getting and what you're not getting. Like, we have to start from food, right? And she even admitted, she was like, I've asked all my other practitioners if that mattered, and none of them gave me the time of day to answer that. And I was like, absolutely it matters, but the reason why they haven't told you it matters is because they don't have the bandwidth or the capacity to teach it to you. They're like, I need to churn and burn through X amount of patients per day in order to meet some quota, right? So it's like they see you, a cookie cutter, hand you pills out the door. So I see this parallel happening where this functional medicine space is on a very slippery slope to become exactly like a traditional medicine space, only the functional medicine space isn't obviously able to take insurance, right? So people are paying thousands and thousands and thousands of dollars out of pocket for these testing, these bottles of supplements, but zero coaching and zero relationship. It's very much the same idea as like, here's a pill for every ill, here's your protocol, and send you on your merry way. And it's like, that's not nutrition. I don't know how else to say it, but that is not what I mean when I say you have to start with food, right? So wiping the slate clean, how are we going back to the drawing board and understanding that, yeah, there might be some supplements that might fit into your approach, but you cannot mimic what we're getting from food, lifestyle, sleep, the sunshine, water, that you could ever potentially bottle into a supplement. So just stop trying, right? So that was one of the big aha and awakening moments that I felt like I needed to at least have a platform to have a conversation around this when I see somebody come in who she does not look and feel the way that she wants to look and feel. She's not able to show up as a mom the way that she wants to. She has major health concerns that she's worried about and a lot of built up anxiety because of it. And when you're walking into my office and all that's been given to you up until this point, thousands and thousands of dollars of in-depth testing later, and all you have to show for it is a bunch of supplements and pill bottles, and half of them you don't even know why you're taking them, that's a problem. That is a huge problem. And it to me would be it was no more shocking than someone walking in with bags of prescription medications. So you look at that, and most of the time, most individuals today, there's kind of that silent judgment about that, like, whoa, look how many prescription medications that person is on. But nobody blinks an eye when someone does the same thing with bottles and bottles and bottles of supplements. It's like, we've got to look at a real food foundation here. What are we really doing? Right? Are we really building health at this point in time, or are we building more anxiety and more health issues because now we don't even know what we have or what we're missing, right? So again, I am not anti-medication. I am not anti-supplement, but I do think that there are about kind of four main key points and factors that we need to consider when it comes to using supplements properly. And a lot of these to me also go into using things like pharmaceutical medications properly and making sure that we have informed consent, that someone is telling us, hey, this is exactly why we're using this. This is exactly how long we're using this for. And this is what we're going to be doing behind the scenes to get you off of this. That to me is a great practitioner. That is somebody that is recognizing like, okay, this is going to be a series of steps. We didn't get here overnight, but there's also some strategies that I want to use to help you feel better right away, get you some immediate relief, but that's not going to fix anything. It's really just a Band-Aid. It's taking some of the perception of the symptoms away, but it's not taking the symptoms away, because the second that you stop that, all of the symptoms are going to come back. So you didn't really fix anything. That's the problem that I have with this like supplement and kind of big pharma, where they're starting to look very oddly similar across the traditional and the functional medicine space. And I'm not okay practicing that way. So, and I'm okay calling it out when I see it, right? Because I see a lot of individuals that come to me really lost from both sides. And I want to give everybody a better viewpoint of what it should look like, so that you guys know what to look for in a practitioner and also what to ask about. So when we're thinking about truly getting rid of symptoms, we're talking and building health, building metabolic health, we're talking about optimizing from the level of the brain. Right? So I don't think a lot of people recognize that. It's like, oh, so we're trying to get my brain out of this fight or flight state. We're trying to get my brain to stop recognizing or perceiving excessive threat. We're trying to regulate things like energy production in my internal and external environment. It's like, yeah, that doesn't sound like something a supplement can do. No, it can't, because this is about your daily habits and the environment that you tell your body what is safe or not safe every day. So there's a response to that, right? So when we think about how am I going to use supplements properly and what's the right and wrong way to do this, I think there's about 4 key factors. Number 1, look out for blanket recommendations. And what I mean by blanket recommendations is specifically trying to put a broad reach on what your diet should definitely be covering. So I'm not a huge fan of like multivitamin. It's like, those are all things you should and could be getting through food. So it's like blanket multivitamin, blanket fish oil, blanket probiotic. Everybody needs calcium and magnesium and vitamin C and zinc. And it's like all of these like blanket recommendations, all of that stuff I feel like we can definitely source through food when done properly. Right? Again, is there maybe a time and a place for certain people to supplement specific things while they're trying to work on a diet that's getting them to that level? Sure, I could see that, but very few people are actually doing that. Most people are taking these blanket things because they're noticing symptoms, but they're not in a place where they're willing to admit or make the dietary changes that are necessary. And so they just try to blanket out supplement anything and try to justify or let themselves off the hook for the actual change of the big picture. So watch out for blanket recommendations, and also any recommendations that are made without labs. Labs should always be run first before recommendations are giving. So I would say anybody that's just blanket recommending anything without labs is red flag number 1, right? Red flag number 2, also look out for the quality and the sourcing of supplementation. An example that I'll give is the form in which supplements are made. You'll want to look for, if you are taking supplements, you'll want to look for something that is a capsule. You should be able to physically pull the plastic pieces, the gelatin pieces of the capsule apart and pour out the inner contents, right? It should be a capsule versus a tablet or a hard pressed tablet style pill, especially if they're coated, right? So you want a capsule, not a tablet, definitely not a gummy, right? Let's be real, okay? We're grown-ups, we're not taking gummies anymore. And the amount of gummies that you would need to consume to actually get anything of substantial value from gummies would far exceed your sugar quota for the day. So let's not, right? So look for something that's a capsule versus a tablet. Another fun kind of scientific test that you can do with supplements is put any of your supplements in a little Dixie cup with 100% pure apple cider vinegar, because it's the same pH as your stomach acid. So you'll be able to drop your little capsule capsule into a Dixie cup, and you should be able to come back about 20 minutes later and look in that Dixie cup and see nothing. It should be completely gone, completely dissolved, clear. If you go back to it and you can see that there's a film in there or it's super cloudy, then chances are that supplement, whatever you're taking, has a lot of fillers in it, and what you're actually getting is probably not very pure. So, fun little science experiment. You can all tag me in social media and show me what you guys are doing looking at your different supplements in apple cider vinegar. So look for things that are a capsule versus a tablet form, right? So red flag number 1, look out for blanket recommendations that practitioners are making without labs or things that you should be getting and sourcing through food. Red flag number 2 is the quality of those, whether it's like a tablet or a gummy form versus a capsule form. And then red flag number 3 is not having a conversation about informed consent. Why are we using this supplement? And what is the habit change that I'm going to be working on behind the scenes to correct this deficiency on its own? So making sure that the supplements do not try to let you off the hook for habit change. So here's a very typical example one that I'll give you. Vitamin B12, right? Vitamin B12, something that we run on all of our labs. It's an energy vitamin. It's absorbed in your stomach acid. Individuals that have low B12 usually have low stomach acid, so they might deal with digestive issues, food sensitivities, bloating, SIBO, reflux, right? And chances are that B12 is also deficient, right? So when I run labs and I see somebody deficient in B12, I let them know, hey, I don't think you need to jump on a B12 support right now, but I do think we need to talk about increasing your protein intake and increasing the quality of your protein intake, and also inserting some strategies to help improve your body's own stomach acid production so that you start to absorb the B12 you are eating. Right? So it's like I put a pin in it. I let them know, hey, this is what we're going to be working on. When I retest this in 3 months, if your B12 is not improved and you've put in these habit changes, then we can have a conversation about B12 supplementation. It's right. It's like, or the other way around. It's if they want to start B12 supplementation, I'm like, that's fine. We can start B12 supplementation right now, but we're starting it with the intention of working on your protein intake and diversity and improving your stomach acid production so that you can then phase off of that B12 and your body is getting it and absorbing it naturally through food. Right? See how that I always have an exit strategy, which brings me to red flag number 4 is not only should we be avoiding blanket recommendations that are being done without labs, we also should be avoiding improper quality sources like hard-pressed tablets or gummies. We should also be looking out for red flag number 3, which is supplements that are not coming with a habit change conversation. And red flag number 4 is a conversation around exit strategy. Right? So just like in the example that I gave there, the whole goal is hey, if I'm putting a supplement in, I'm telling you how long we're using it for, exactly why we're using it, what the dosing titration of that looks like, where we're gonna max out, and how we're gonna wean off. Right? There should be an exit strategy for those types of things. And to me, it's the same thing when it comes to things like strategically utilizing certain medications, right? It's like, hey, if we want to start a medication to really help you with some of your hormonal acne right now, cool. I mean, that can be a confidence just debilitator for some people. Let's go ahead and get that on board. But hey, I want you to be working with Lauryn on working on your gut issues and balancing out your stress and your androgens so that your body can reduce hormonal acne from an inside out perspective. And this can be a medication that you can then wean off of in the future. Let's get to the root of why that hormonal acne is an issue for you, right? Are you seeing how these conversations just sound and feel very different than like a super quick, here's your labs, here's your symptoms, here's a pill, check back in 6 to 12 months. That to me, that's not improving anybody's health, There's no health focus going on there. That is really just like a thank you next. Thank you next, right? And it just feels like such a churn and burn type of mentality and such a cookie cutter and template approach that it's really not equipping anybody for long-term success, especially individuals that don't necessarily want to be shelling out hundreds and hundreds of dollars on supplements or even medications that aren't necessarily covered without understanding what that root cause approach is. So this was just my, like I said, at least introductory conversation for you guys to start to get a little behind the scenes look of some of the things that I see as, yeah, a lot of times we can dog on traditional medicine for not being proactive and preventative when they're more designed for acute care scenarios. And then we turn over to a functional medicine route, hoping to get that preventative and proactive approach, but we're just met with the same exact care strategy, which is a pill for every ill, but this time it's a supplement bottle instead of a pharmaceutical intervention. It's like it still doesn't define health, and it doesn't build health for anybody. So be on the lookout for those top 4 red flags that I mentioned when it comes to utilizing supplements. And if you feel like you are somebody that's kind of trapped into a pretty deep wormhole of like, well, I started this for this and this for this, and now I don't even know what's what, and no one's really helped me address a food first approach, don't hesitate to reach out. That's exactly what we do, is we want to make sure you have a test, don't guess, and you understand, like I said, that yes, things like supplements can be very useful and beneficial, but it should not be the first conversation. And they should always come with a conversation around why are we using this? What is the habit change that we are promoting and working on behind the scenes while this is on board, and what is the exit strategy for that specific supplement once that habit change has taken over. So hopefully that's helpful for you guys in, like I said, kind of navigating that little bit of that messy middle, and you guys feel more confident and informed consumer of really seeking out all of your different health options and making sure that you're getting what you're looking for. So if you guys have any other follow-up questions, don't hesitate to send me a DM. Check out the link in my bio if you have any questions about options of working with me with any of my courses or programs or one-on-one coaching. And we'll see you guys again next Monday for more Learn with Flo.